Well, good morning. My name is Bryan Mills. I'm the president and CEO of the Community Health Network. And I frankly could not be more excited for this announcement than anything that we've done in my going on 30 years at this organization. If I say the words MD Anderson, if you're a physician, that means a lot. If anybody's ever told you had cancer, it means a lot. If anybody's ever told one of your family members that they have cancer, that means a lot. But to the general public, it may not mean much. I hope after today everybody understands what that means and what that means to our organization and our commitment to provide quality care to all of our patients who entrust their care to us. MD Anderson, it stands for Cancer Excellence. You know, U.S. World News rates hospitals, rates organizations, rates programs. If you go to that site and you ask about cancer hospitals, there's only one place that's number one. They've been number one 9 of the last 11 years. The last 6 years in a row, and right now, number one. So when we were trying to figure out what can we do to make sure our patients get the best care for cancer, what do? You look out to places that are the best. And about a year ago, all these wonderfully dressed people with these beautiful white coats, I hope someday to get one of those. I had this epiphany that said, I wonder if I can find a way to have a place with the reputation of MD Anderson work with us. But the last thing I wanted to do was offend any physician who was providing service here. So I started talking to our medical oncologists, radiation oncologists, surgical oncologists, and said, I got an idea. What do you think? And I was overwhelmed, absolutely overwhelmed to a person. Every one of them said, MD Anderson? I said, yes. They said, Bryan, that's top-notch care. I said, I understand that. What do you think? And they said, let's do it. Let's see what we can do to bring MD Anderson to Indianapolis. So I started talking to Mr. Bill Hislop, who's the president of the MD Anderson Cancer Network. I started talking, he introduced me to Dr. Bill Murphy, who's going to speak in a minute. And Dr. Murphy is the chairman of the board of the MD Anderson Physicians Network. And lo and behold, they're looking to see how can they affiliate with local organizations like Community to spread the MD Anderson evidence-based guidelines to local communities so that we can deliver their care here. And we start going through a process. It's a rigorous process. They've got very high standards, and these physicians and our staffs at Community East and Community North and those cancer centers have gone through a heck of a test, and we've achieved it. And so today, what I'm most proud of, I'm proud of the affiliation we're announcing. I'm proud of the fact it's going to start at Community East and Community North. I'm proud of the fact that we're going to expand that in other places within our network. We're looking to take this to Anderson and Kokomo and South and other places we go. I'm proud of all that. I'm proud of our physicians' commitment to what we're doing here. But most importantly, I'm proud of the fact that as it pertains to citizens of Indiana, my family, your family, if unfortunately you ever have somebody tell you have cancer, we're going to do everything we can to provide the best possible outcome for you at this organization, working as a team in affiliation with MD Anderson. And I'm glad that we have representatives from the American Cancer Society, the Leukemia and Lymphoma Society, Little Red Door, and others. And I hope everybody understands the significance of this. And this is our commitment to the cancer, and it's going to be our commitment to everything else we do to make sure that when you come to Community, you get the best quality you can possibly attain. And with that, I'd like to have Dr. Bill Murphy come up here and share a few words with you. Thanks, sir.
Oh, good morning. Beautiful, bright, wonderful, cheerful morning, sunlight streaming in through the windows. Couldn't be a better time for us to be here. Thank you, Bryan, for your introduction and for your vision. We commend you, and we commend all of the leadership in the oncology project here who've worked so hard to get us here to this morning. Thank you. Your passion is clear. Community Health Network and the people it serves benefit from your leadership and from your commitment to healthcare excellence. Bryan, you had some very nice things to say about the MD Anderson, and we are very proud of our reputation as one of the world's most respected cancer centers, focused on patient care, on research, on education, and on prevention. For over 70 years, we have been focused on one mission only, and that's eliminating cancer. But it's not enough for MD Anderson in Houston, with its over 18,000 employees, dedicated doctors, nurses, technicians, staff, and volunteers, to fight cancer in just that single location. It's just not enough. We need collaborators across the nation, indeed, across the world, to help us fulfill this mission to eliminate cancer. We've just got to have collaborators. And we know that only by teaming with other premier organizations dedicated to providing the best in medical care for patients can we touch more lives and hopefully save more lives. We value collaboration. Let's be clear about this. We don't collaborate with just anyone. We seek affiliations with only the best healthcare institutions, those that share our commitment to improving the delivery of healthcare, those who have an outstanding reputation in their region, and who believe in our patient-centered, multidisciplinary approach to care, to eliminating cancer. I am proud today to say we have found that kind of collaborator in Community Health Network. And I'm excited to welcome Community Hospital East and Community Hospital North to the Anderson Cancer Network as our first affiliate since we've developed that network concept and as our affiliate here in Indiana. As with all of our other collaborators, Community East and North hospitals were carefully vetted, and you know a lot about that, and underwent rigorous evaluations to become members of the MD Anderson Cancer Network. What we found during our reviews is not only do these individuals dedicate themselves to the process, but they are truly patient-centered. They care about the patient. The patient comes first. Community health patients already have local access to expert physicians, comprehensive and state-of-the-art care, and leading-edge technology. Our new affiliation builds on those strengths by adding MD Anderson expertise. And we are confident this combination of existing expertise and MD Anderson expertise will raise the bar even higher for cancer care across Indiana. As a result of this affiliation, Community East and North certified physicians, here they are, These certified physicians have access to the resources of a major cancer institution with road-tested quality assurance tools, with best practices, and with evidence-based clinical care guidelines for use in treating cancer patients. Equally important, they will have direct access to MD Anderson physicians in Houston. And we know that when oncologists collaborate to fight cancer together, patients benefit. MD Anderson faculty will be available to consider and to confer with these certified physicians at Community East and North. We'll be there to share best practices for patient care and to discuss treatment options. There will be a direct connect with Houston. Patients of credentialed physicians receive care in accordance with MD Anderson's multidisciplinary approach to cancer care, in which physicians from various specialties, including medical oncologists, radiation oncologists, and surgical oncologists, join together to plan the patient's cancer treatment. Credentialed oncology physicians at Community East and North will also have opportunities for multidisciplinary teleconferences between the two organizations, allowing MD Anderson faculty to review cases as necessary and to encourage the use of multidisciplinary treatment planning. Indeed, this is a collaboration between two great institutions with great expectations. So together, we will combine our experiences and our knowledge to build a long and fruitful relationship. Together, we will offer more people and communities in Indiana access to the highest quality cancer care available. And together, we will work to make cancer history. Thank you.
Dr. Murphy, thanks for your words and your commitment, and we look forward to our collaboration. I've got two physicians, certified physicians now, that, and they look great in their coats, that I'd like to have come speak a little bit more about what does this mean? What does it mean to them? What does it mean to their patients? So first, Dr. Sumit Bhatia, medical oncologist.
Thank you, Brian. Thank you, Dr. Murphy. This is a wonderful day for all of us at Community Health Networks and also for all our patients with cancer in Central Indiana. Today's announcement is a culmination of a vigorous vetting process which lasted over 6 months, in which medical, radiation, as well as surgical oncologists were vetted by a team from MD Anderson over a period of 3 visits, which has essentially confirmed that Community Health Network has been providing superior care to our cancer patients. Over the last 6 months, our facilities have been inspected, our workflow and charts have been audited, and our safety standards examined. I'm proud to say that we have met and surpassed all the expectations set by MD Anderson. And for this, I must thank all our physicians for the superior care they provide, to the nurses for their dedication, to the pharmacists who've taken care and protected us in everything that we do, and to the administrators who have made all this happen. I would specifically like to acknowledge Cindy Lewis, Dr. Naftali Becker, Pam Dickerson, and Jennifer Jones from pharmacy, who over the last few months have put in hundreds of hours to make this collaboration come true and help with the accreditation process. So what does all this mean to our patients? For us at Community, our most important value has been patient care and ease of access to our patients. This accreditation reaffirms that we combine those values and provide world-class, evidence-based care to our patients. It opens up opportunities for collaboration with the #1 cancer center in the country, no, in the whole world, in taking care of our patients. While all patients and cancers are unique, in most situations, it provides reassurance to our patients that we provide the best care in the world locally. Specifically for our patients, the opportunity to collaborate with physicians from MD Anderson who have national reputation allows us to review their cases without the need to travel, saving cost, expense to all of them. In truly complex and unusual cases, for example, in diseases like sarcoma and mesothelioma, it opens up easy access for those patients to travel to Houston and get care over there. In patients with refractory diseases, access to MD Anderson opens up research avenues and our ability to help conquer these diseases and offer hope to our patients in the most desperate situation. Future plans include access to clinical trials, use of novel agents, and telemedicine, all directed towards helping with patients in their day-to-day care. All in all, today we've taken a step in the right direction in our mission to provide the best world-class cancer care in our community and locally. Bryan, Dr. Murphy, thank you for making this happen. It would not have happened without your vision and leadership. Thank you.
Thanks, Sumit. And finally, last but not least, Dr. Shekhar Narayanan, colorectal surgeon.
Thank you, Bryan. Good afternoon, ladies and gentlemen. First of all, today is a historic day in medicine for the state of Indiana. I am honored and proud to be a part of it. I will keep this short so as to allow time for questions. When Bryan approached me about his vision of bringing MD Anderson Cancer Network and Community Health Network together to deliver the highest level of cancer care to the people of Central Indiana, it blew my mind. I'll take a quote from my alma mater football team, the University of Miami's head coach, Al Golden, who said, "Are you kidding me?" And then he repeated it. He said, "Are you kidding me?" I'll share with you a story. I did my fellowship in 2001 in Orlando Regional Medical Center. It happens to be that MD Anderson has their first affiliate or first visionary hospital in that same location. And so I was blessed to work with my colorectal attendings with the MD Anderson physicians in Orlando. I witnessed amazing things. The caring, the expertise, the unrelenting drive of those physicians was unmatched. Those physicians were able to deliver the highest patient, quality-focused care, both surgical and medical, and maximizing patient understanding, patient quality of life, and the most important thing of all is the outcome. We expect nothing less here, nothing less. My physician colleagues over here have all volunteered to be a part of this vision. We have all gone through this extensive screening process, have met and wanted to meet MD Anderson's highest expectations for certification in their cancer network. We're all incredibly proud of that. But more importantly, we're excited about what it can do for our patients. Because in the end, this adventure, or this venture, whatever way you want to call it, is about the patients. I can say with certainty that the physicians here have the same unrelenting goal as both Community Network as an institution and MD Anderson Cancer Center Network as an institution, the elimination of cancer. So on a personal level, unfortunately, I've had this situation happen to me. I have family members that have been through this, and to go back to where dealing with people in my own family, if I had the opportunity to collaborate with an MD Anderson and their expertise, and whether it be through teleconferencing, whether it be through discussions on the phone, that is a valuable tool for the patient and their families, because this is a collaborative effort between physicians, doctors, patients, and families. I thank you all for being here. I think this is a monumental day, and I thank Bryan, I thank MD Anderson, and we want to thank people, and that's what this is about. Thank you very much.
Thanks, Dr. Ryan, and except for the Miami quote. We could have done without that. That concludes our program here, but we'll be glad to answer any questions or address any things that people might have. Any questions? You are far too kind. Thank you all so much for being here, and we look forward to providing service to you. Take care.